Hi, my name is Dr. Lynn Patrick. I'm a licensed naturopathic physician. I have been practicing since 1985 in Arizona and now in Colorado. And I'm also the medical director of EMEI Global, which is a platform for healthcare providers for postgraduate education in environmental toxicology and environmental medicine.
Great. And what initially drew you into the healthcare space?
Oh, that's a great question. And I'll give you the honest to God answer. Um, after I got out of college, I got a summer job as a counselor for the Youth Conservation Corps, which exists still today, right? And the kids were so sick all the time, and I was the only counselor with the interest and capacity to offer them healthcare. So I would be the one driving them to the doctor this was a town in Eastern Washington, very old school. He would give them the wrong medicine for what they had. I knew it. I wasn't, it was just common sense. And so I was so frustrated and so angry and sitting on a break after work and saying, like, what am I going to do? What am I going to do? And I swear to God, I heard a voice. I was not using any mood altering anything. And I heard a voice say to me, there is something you can do. Go to naturopathic medical school. It was clear, like somebody was sitting next to me. I immediately said, not interested. My boyfriend at the time was in his first year at University of Washington Medical School, having a nervous breakdown. So I knew anything that had the medical school on the ending was not for me. However, I was a student of the amazing Dr. Jeffrey Bland, who is a leader in the healthcare space. Literally, he was a faculty at the college that had been going to prior to me graduating. And he had sat me down and said, what do you want to do, with the rest of your life? And I said, I'm going to go to Cornell. I'm going to get a PhD in nutrition. And he said, no, you'll never be happy doing that because you'll be in a lab stuck with a bunch of rats. I want you to go hear this guy named Dr. Joseph Pizzorno, who is the founder of Bastyr University, who I'm now still good friends with these 40 years later. And he said he's coming to the college, he's going to lecture. So I went and I heard him lecture, and he was mind blowing, gentlemen. And so I had already had it in my brain. So I went back, took a little bit of, I had to take some classes in calculus and physics. And then off I went to naturopathic medical school, and that was in 1979.
Mhm.
And then I graduated, and off I went into private practice.
Who would you say would be your most influential mentor? And what did you learn from
I
them?
always have to say and credit Dr. Jeffrey Bland, who founded the Institute for Functional Medicine, has written more books than I can even count. And to this day, I just saw him in New York City at the conference there. Dr. Jaffe was there too,
Yeah.
and thanked him for the last 40 years of guidance. He is a genius, literally, as well as really creating a whole new way of practicing medicine. Dr. Jaffe as well, Russell Jaffe, I met in 1987. He, of course, as we all know, was a senior research fellow at NIH. Brilliant, another genius, brilliant man. And he and I both at that time were treating a lot of AIDS patients. My practice was uh, about 50% people with HIV and AIDS. And he literally helped mentor me and guide me through that in a way that I never would have been able to without him. So I credit him for that, as well as helping me understand the role of nutrition and especially ascorbate in the treatment of that chronic viral illness. So he's been guiding me, and I've been learning from him up until the current moment when he was so gracious as to be a guest faculty for my 12-month course in environmental toxicology and environmental medicine.
Okay. What would you say has been the most defining moment of your career so far?
Oh, there are so many. That's a hard question. The one that comes to mind right now is my mentor, another brilliant guiding light in my life, Dr. Walter Crinnion, who, with Dr. Joe Pizzorno, published the clinical environmental medicine textbook, which is a Bible for those of us who are practicing environmental medicine. I was very close to him. He and I taught together for about 20 years. We taught environmental medicine together. He became very ill, unfortunately, and passed, and I was with him on the last day of his life.
Mm.
And at that time, as he was literally, he knew he was leaving his body. He was very aware of what was going on inside of him. He had an acute systemic infection. He said to me very gently and kindly, he said, you will carry on for me, won't you? I said, of course I will. And I meant what I said because I then took over his work, basically teaching environmental medicine and his platform for doing so in environmental toxicology and environmental medicine. So from that day onward in March of 2019, we've been gathering doctors from all over the world to teach what Dr. Bland and Dr. Jaffe and Dr. Crinnion have taught us. Plus, as you know, this field changes about every 2 minutes. And
Yeah.
so we have this fire hose of information that's coming at us that we have to basically integrate into our clinical practice. So we're doing that. My life did change at that moment. I mean, it was really pivotal for me to have that experience of being with him when he left his body, but also to make that agreement in my heart and soul. So I have others, but that was a big one.
That was the one that
Just
stuck out.
here now, 7 years ago.
Yeah. What role do you believe supplements play in patients' healthcare journey?
When I was first in practice, and I have to say, it was a rocky entry into medicine because it was 1985 and AIDS was just really becoming a thing,
Mhm.
meaning it was a quandary, a conundrum, a political upheaval. Nobody knew what to do. And I had been able to meet some amazing people in the field of kind of this pioneering of uh, supplemental using nutrients in medicine as not just supplements, but as medicine, as pharmaceuticals. And I met a guy named Irving Stone and his cohorts who were treating HIV and AIDS in California with intravenous vitamin C. And it was then that I started really understanding in my own experience what that medicine does. And from that moment onward, I've been using not just IV, but oral mineral ascorbate to literally alter people's biochemistry, to give people back what I want to call normal oxidative metabolism or normal antioxidant metabolism. So I know that sounds a little far-fetched, but it's really true. And Dr. Jaffe also has continued his own research in that way with the C cleanse. And he's such a genius in that he really figured out how to individualize the use of ascorbate as well. The use of magnesium, which he also taught me, is critical. It's so critical. And honestly, because I've been teaching doctors for the last, what are we, 27 years now, I will tell you this somehow has not gotten into the brains of even functional medicine doctors that everyone is not only deficient in magnesium, that many of us, another one of my mentors, Dr. William Ray, who's a giant in the field of environmental medicine, actually did research and published this, that a lot of us are diuresing magnesium. We're literally losing what precious little magnesium we get from our diet and what few supplements we take. And so that has to be addressed. And Dr. Jaffe figured it out. And so since he figured it out, I've been very clear about this with my doctors is you must help re I don't know what the right word is, regenerate or reinstitute normal physiologic uptake of magnesium in the body by using choline. So it's still mind-blowing to me how few doctors know this.
Hmm.
And his research is clear. He lectured in our course on this, that choline is literally critical in reestablishing normal magnesium uptake and retention. Humans are not only unique in their needs, but every single human has something called individual biochemistry, right? We have individualized needs for nutrients. Jeffrey Bland understood this, and I think that certainly Russell Jaffe understood it as well. And so this method of identifying and treating, now we have genomics, so we can even go a step further, right? But this method of identifying and treating has to be instituted in naturopathic medicine, functional medicine, I don't care. Chiropractic medicine. I've even taught, I had a professorship at the doctorate program at the acupuncture school in San Francisco. And even those very bright individuals, they didn't have the opportunity to learn that. And so we taught them that. And they were like, oh, this makes so much sense. Everybody's different.
Yeah.
So
It's funny that you mentioned magnesium because out of all the perk products that we have, magnesium is the one that I take daily, religiously. It has,
you have to.
yeah, I
Everyone has to. We are no longer able, it always entertains me when I see people say, oh, you just use this food-based supplement because it's made out of food. It's got everything you need. Well, maybe in 1925, that was true. But since the inception of uh, conventional, what we'll call conventional agriculture, and the
mhm,
input of pesticides and herbicides, that's no longer true. So, sorry, we must do this to maintain normal physiologic function, especially now that we are exposed to this kind of panoply of toxicants
mhm,
that we all have to metabolize and figure out how to excrete, right? And I would also add, because I know there are healthcare providers listening, biotoxin illness, which is a way that we refer to Lyme and co-infections, as well as mold and mycotoxin exposure. Critical for those patients. It's critical. So
cer-
one more thing I want to say about this, because this is a pet, well, an area of fascination for me.
mhm,
The other piece of research that Dr. Jaffe has done that is so critical is how to pair polyphenols. So
mhm,
polyphenols, we know them as bioflavonoids, basically, but they're whole families of polyphenols. How polyphenols pair with vitamin C to effect, and I'm talking about environmental medicine now to effect our capacity to excrete toxicants. I
mhm,
think Russ is one of the few people that recognizes this. We now know, and I'll give you a really concrete example. Bisphenol A, everybody's concerned about plasticizers because they're in microplastics and
mhm,
nanoplastics. Polyphenols assist in the excretion of bisphenols. That's literature that is, multiple studies showing this. And what Dr. Jaffe has done is he's actually identified what are the most effective polyphenols to do this. And so he has taught us a lot about quercetin. He's taught us a lot about the polyphenols in pomegranate, how those are paired with ascorbate, and what the actual effect of that combination is. critical research. I know he's published this in an actual book that he writes chapters in for physicians on functional nutrition. They are the answer to so much of this mess that we're in with environmental toxicants. That we do not recognize. The answer is right there in front of us in the literature. Hundreds and hundreds of articles looking at the efficacy of polyphenols. But I think that's another critical piece that Dr. Jaffe's given us and that PERQUE offers is that combination of quercetin and pomegranate uh, concentrate and mineral ascorbate. And as Dr. Jaffe has taught us, there's a specific way to make that mineral ascorbate under a nitrogen blanket. He learned this from Linus Pauling. I mean, this was a lost piece of information that he's gathered and pulled forward for us so that we can utilize that. All all ascorbate is not the same. And so I really want to respect and express my gratitude for him for that. And so often we think, I just did a webinar with a organization that I started called the National Association of Environmental Medicine, which
Mm.
is a physician member organization that specifically educates doctors about environmental medicine. And this was on supplement safety. And we've been doing this project, the Supplement Safety Project, for 4 years. We were able to identify some of the serious problems in the supplement industry around safety and contamination. I'm talking about pesticides and solvents and metals, those three areas, right? And so I think it is rare and critical for us to be able to identify the supplement companies that do the right testing for pesticides and solvents, and especially for fish oils. Whoa, the fish oil industry is just a mess. And to be able to identify companies that are actually doing the right testing for fish oils for rancidity and peroxidation is critical. So I know Dr. Jaffe has lectured quite a bit in my course about that. And I think, you know, if we're going to do our patients any favors, we have to teach them how not to buy fish oil at those big box stores that everybody goes to for their groceries and has a membership in. I'm not going to say the name, but never let your patients do that. So I think the supplement safety is a critical thing too, and I'm really thankful that companies like PERQUE and Dr. Jaffe, God bless them, do that hard work of making, testing for supplement contamination because raw materials are rife with contamination right now. It's a really difficult thing.
Now, you've kind of already mentioned supplements and your choice in supplements. What do you personally look for when choosing a supplement? Like, what stands out to you in knowing which is a good supplement, which is an okay supplement, which is one you
Uh,
would pick up personally?
well, I know the companies and I know the behind the scenes testing that they do and they don't do. Unfortunately, not all doctors, not all providers know that, and no patients know that. Companies are expected to follow good manufacturing practices and to do some level of discernment in the area of metals, arsenic, lead, cadmium, and mercury, in the area of molds and mycotoxins, but also the good companies will do it in the area of pesticides and solvents. I wish that question were easier to answer because I know Dr. Jaffe personally, and I know how the supplements are manufactured and produced. I know the level of testing that's undergone, and that's true for other companies as well. I don't want to say that PERC is the only one.
Yeah.
Uh, there are other companies that do that testing as well,
Hmm.
but uh, PERC is one of the companies that I know does that testing, and I know I can get access to that testing if I need to. So I don't know. It's a hard question to answer. I wish I
It is a hard question to answer. And it's funny because my next question was kind of going to be roughly, why do you choose perk supplements in your practice?
Two reasons. One is if you go to the trouble of producing your mineral ascorbate in a nitrogen-rich protected environment, you don't have to do that. I think PERQ might be the only company that does that. But if you go to the trouble of doing that because you're following the science, that's like 5,000 gold stars for you, right? That's in my book, because I'm a science geek, I think that's critical. The other thing that I will say in answer to the prior question is that what a lot of companies will do, I used to work for a supplement company, so I know a lot about the supplement industry as a result of being in on that. One of the things that supplement companies will do is what we call window dressing. They'll
Hmm.
give you a proprietary formula so they don't have to tell you how much is in it, and they'll list 25 herbs. I just got a label from one of our doctors in students in our class, like, isn't this a great formula? There are like 25 herbs in there. I said, there's no way that you can create a formula like that. Maybe it has some energetic effect that I can't perceive. But there's no way you can create a formula that has any discernible effect with that many. It's only one, I know how many grams are in a capsule. You do the
Hmm.
math, that's 50 milligrams at the most. So PERQ is very transparent in that. Like, here's what's inside. This is how many milligrams. It's not a lot of stuff because we want you to get a certain level of supplementation. So I wanted to mention that whole window dressing trick that the industry uses. It is literally a trick, and it is a kind of a big red flag
Hmm.
in the supplement
Now,
industry.
you've already mentioned our magnesium and our choline citrate, and I believe our sea powder, L-ascorbate sea powder.
Yeah.
Do you have any other favorite perk products, and what makes
Well,
them
of
stand
course,
out to you?
quercetin, vitamin C, and repair guard.
Yes.
So repair guard. That there's research behind that. It's not just, oh, let's throw this together and see if it sells. There's research behind that. And I think one of the things that for doctors, it's a very confusing time because we're living in the culture of, oh, just load them up with methylene blue, give them IV methylene blue, and they'll, you know, no, that's not a good strategy. If you look at the actual physiological biochemical effects of methylene blue, it's a band-aid on a Hoover Dam that is about to break open. So we have to get down to cellular repair strategies. And things like fish oil, that's a cellular repair strategy. That's the other product that I absolutely trust and depend on. And the repair guard is a cellular repair strategy. Yes, our cell membranes are really not functional. We have to make them functional. And so the strategy for doing that involves things like DHA, which is in the fish oil, and polyphenols, which are in the repair guard. So I think those are critical as well. There are probably others that I'm not thinking of right now, but that's a good beginning for sure.
Now, taking it back to you personally, what can patients expect when they come to your practice?
So I'm no longer in clinical practice, but I'll tell
Okay.
you what I did for almost 40 years now.
Okay.
As a model for the doctors that I'm teaching, that are graduating from our course, um, one of the most important things that you have to look for in a physician is somebody who has an attention span that allows them to literally identify your personal history. I always ask about family history, not because I believe diseases are genetic, but because I know that what you were exposed to when you were growing up, what your parents were exposed to, has affected your genome and affected your biochemistry. And so taking a thorough history, and we gave every single one of our patients, we mailed it out 2 weeks at a time, an environmental health questionnaire, which asks you about your entire residential history, your occupational history, and your lifestyle exposures. And in the clinic that I worked in for many, many years, I was the environmental health expert or specialist. So everyone would get funneled to me who had any potential exposures. And what I did, now we have a wonderful tool called ToxyMap that
Hmm.
does that automatically. You should check them out. But what I did is I pieced together through their residential history if they lived in every Superfund, if they lived in any Superfund sites. And I will tell you from my clinical experience, the majority of sick people with chronic complex illness lived in a Superfund site. Unbeknownst to them, there are no signs that say, hey, you're entering a toxic waste zone. And they were exposed to, through their drinking water, TCE, atrazine, organochlorine pesticides. I could go on and on. And
Mhm.
so I could piece together the trajectory of their illness up until the current moment. Now, not all, very few doctors are going to do this, right?
Mhm.
But I want to make it clear that we now know genomics or genetics are a small part of the problem. Environment is the mm, phenomenon that pulls the trigger on the gun, right? We always say the genes load the gun, environment pulls the trigger. That is so true. And so current exposures, I want to make clear that I live in an area that is very close to one of those sacrifice zones in the four corners of the United States. And so we saw a lot of people from the gas and oil
Mhm.
um, areas where there was fracking. We still do that are very sick. We were ground zero for fracking in the United States of America in northwestern New Mexico. So we saw a lot of sick people. Those sacrifice zones still exist in the United States, in Texas, in North Dakota, in Oklahoma, in West Virginia, in Ohio. I could go on and on. But your physician has to be aware of that. Perfluorinates or forever chemicals now pollute more than 50% of the drinking water in the United States. Your doctor has to know how to look up your potential exposure through your zip code. It takes 5 seconds. I can do it in 5 seconds. Has to know whether or not those perfluorinate chemicals, very toxic chemicals, need to be measured in your blood. So some functional medicine doctors will know how to do this. Not all of them are schooled in environmental toxicology, but I think that's critical. So that piece of being able to see you as an individual and
Mhm.
not a greater cohort of Americans in your age group, which a lot of doctors do, and the ability to look at your history and your current exposures as a critical part of your health, critical part of your health. So a lot of, our doctors will ask me, like, how do I communicate this to the other doctors I work with? I think that it's a missing piece in medical education. Of course, the Institute of Medicine has identified this as a critical missing piece in medical education. It's missing, to be totally honest, I'm a licensed naturopathic physician. It's missing in naturopathic medicine, in chiropractic medicine, in the education of acupuncturists. We just don't have the ability to get it into the curriculum pre-graduate. It has to be postgraduate. But it's still critical. And I think more functional medicine doctors are getting educated in these areas. They're listening to me lecture, they're going on to get more education, but it's critical. If your doctor does not ask you, for instance, whether you're exposed to pesticides if
Mhm.
you live in a rural area, if your neighbors spray pesticides, if you use pesticides, that's a huge missing piece in your health. Huge. I'm talking about allergies, asthma, infections, chronic infections and acute infections, autoimmune disease, risk for cancer,
Yeah.
all of that. that. So I don't know, I could go on and on, obviously, about that, but I think that that's something to pay attention to.
No, yeah. Well, that was honestly all my questions for today. Lynn Patrick, you have been amazing. Is there anything else that you would like to add before I let you go?
For the healthcare providers out there, we teach a year-long course, so it's really like it's a fellowship in environmental medicine. A lot of doctors don't have the time for that, the
Hmm.
time or money to do that. But please, please avail yourselves of any resources that you can. There are books like the clinical textbook in environmental medicine. I know Dr. Jaffe has resources in this area, Survival in the 21st Century. I love that book.
Yeah.
I got all my kitchenware out of that book. I love that book. I wrote Russ, and I'm like, finally, I know where to get a good pressure cooker and all that stuff.
Yeah.
So that's a good book. But I think there are many resources. Our platform, EMEI Global, is also a platform. We have a course for the public called How to Survive in a Toxic World that we wrote.
Hmm.
I don't know if you remember this, but several years ago, there was a disaster in East Palestine, Ohio,
Hmm.
where a group of, I think about 7 rail cars full of highly toxic PVC and vinyl chloride were set on fire for some ridiculous reason that never needed to happen. Well, there was a follow-up study. I did a podcast on this. Um, that was recent, like within the last 3 years, where they looked at the tracer molecules of that burned PVC and vinyl chloride. They found them in Toronto. They found them in Tennessee. They found them on the East Coast of the United States. So that means these volatile organic chemicals were carried all over the eastern seaboard by winds, right? And nobody talks about that. So we were so motivated. We wrote a whole course for consumers called How to Survive in a Toxic World about water filtration and air filtration and what to do with in a chemical disaster, which, by the way, there's one every 3 days in the United States of America. They just don't make it to mainstream media.
Hmm.
Very common. Um, and so I think there's so many good resources. ToxiMap is a great resource. You can go there. I'm on their advisory board, and it's a brilliant group, Harvard physicians and great people who are doing the work of helping us understand our toxic exposures.
And I wanted to ask you before I let you go, if anyone wants to reach out or find you in any way, what is the best way for them to do so?
info.emei.emcourses@gmail.com. And we will absolutely reply. We check in there every day.
Perfect. Thank you so much.
You're so welcome. It's been a pleasure. Thank you for inviting me. What an honor.
Of course. Have a
Tell
great one.
Dr. Give Dr. Jaffe my love, please.
Will do. Thank you so much. Have a good
Take
one.
care. Bye-bye.